Phlebotomy Certification Exam Infection Control Review. Question 1. Before touching collection supplies for a type and screen, why is hand hygiene required? Option A. It replaces the need for gloves. Option B. It reduces transfer of microorganisms between the phlebotomist, patient, and equipment. Option C. It is only needed after visible blood exposure. Option D. It sterilizes the needle after opening. The correct answer is option B. It reduces transfer of microorganisms between the phlebotomist, patient, and equipment. Hand hygiene is a basic infection control step that lowers the risk of transmitting organisms during care. Gloves are still needed when blood exposure is possible. Waiting until visible blood exposure misses routine opportunities to prevent contamination. Hand hygiene does not sterilize a needle or any sterile device. Question 2. After removing gloves following a lipid panel draw, which step should occur next in the Oncology Infusion Center during a scenario? Option A. Touch the computer keyboard before cleaning hands. Option B. Place gloves in the sharps container. Option C. Perform hand hygiene immediately. Option D. Use the same gloves for the next patient. The correct answer is option C. Perform hand hygiene immediately. Hand hygiene after glove removal removes organisms that may be present from glove contamination or removal. Touching shared equipment before hand hygiene can contaminate surfaces. Gloves belong in regular biohazard waste when contaminated, not in the sharps container. Reusing gloves transfers contamination between patients. Question 3. Why should reusable tourniquets be cleaned or replaced according to policy? Option A. They make citrate tubes underfill. Option B. They replace the need for gloves. Option C. They change venous blood into serum. Option D. They can become contaminated between patients. The correct answer is option D. They can become contaminated between patients. Tourniquets contact patient skin and the environment, so cleaning or single patient use prevents cross-contamination. Citrate tube fill depends on collection volume and vacuum, not tourniquet cleaning. Gloves are still needed when blood exposure is possible. A tourniquet does not determine whether blood becomes serum. Question 4. During a final review, which action helps keep a cleaned venipuncture site uncontaminated? Option A. Do not touch the site again unless repulpating with a sterile or policy-approved method. Option B. Place the used alcohol pad back on the site. Option C. Scratch the site to improve blood flow. Option D. Fan the site with the requisition. The correct answer is option A. Do not touch the site again unless repulpating with a sterile or policy-approved method. Avoiding recontamination preserves the effect of skin antisepsis before puncture. A used alcohol pad is contaminated after use. Scratching damages skin and contaminates the puncture area. Fanning with paperwork can introduce contaminants. Question 5. During a droplet precaution blood draw, which PPE item is especially important when close to the patient's face in the occupational health clinic during a study session? Option A. Sterile shoe covers only. Option B. A surgical mask or facility-approved face protection. Option C. No mask if gloves are worn. Option D. Lead apron. The correct answer is option B. A surgical mask or facility-approved face protection. Droplet precautions focus on preventing exposure to respiratory droplets during close patient contact. Shoe covers alone do not protect mucous membranes from droplets. Gloves protect hands but do not replace facial protection. A lead apron protects from radiation, not droplets. Question 6. After activating the needle safety device, where should the used needle be placed in the blood collection station during a structured exam prep drill? Option A. In a regular trash bag if capped. Option B. In the biohazard bag with gauze. Option C. Immediately into an approved sharps container. Option D. on the tray until the draw is finished. The correct answer is option C. Immediately into an approved sharps container. Used needles must go directly into a puncture-resistant sharps container to prevent injury. Regular trash is not puncture-resistant and is unsafe for sharps. Soft biohazard bags are not designed to contain needles. Leaving a needle on the tray exposes staff and patients to accidental sticks. Question 7. If a phlebotomist sustains a needle stick during a clinical simulation, which action should happen first in the outpatient clinic during a clinical simulation? Option A. Recap the needle to identify its size. Option B. Ignore it if the patient looks healthy. Option C. Finish all remaining patients before reporting. Option D. Wash the area immediately and follow the facility exposure reporting procedure. The correct answer is option D. Wash the area immediately and follow the facility exposure reporting procedure. Immediate cleansing and prompt reporting support timely exposure evaluation and follow-up. Recapping increases sharps injury risk and is not needed to report the exposure. Appearance does not determine whether a blood-borne pathogen risk exists. Delaying the report can delay medical assessment and documentation. Question 8. Why should contaminated needles generally not be recapped after venipuncture in the hospital unit during morning rounds during a review? Option A. Recapping creates a preventable sharps injury risk. Option B. It changes the additive in the tube. Option C. It makes the tourniquet too tight. Option D. It causes all specimens to hemolyze. The correct answer is option A. Recapping creates a preventable sharps injury risk. Recapping requires bringing the hand back toward the contaminated sharp, which increases needle stick risk. Tube additives are not changed by whether a needle is recapped. Tourniquet tightness is unrelated to needle recapping. Hemolysis is affected by collection and handling factors, not by recapping alone. Question 9. When a sharps container is near the fill line in the urgent care laboratory, which action is safest? Option A. Place extra needles in a biohazard bag. Option B. Replace or close it according to facility policy before it becomes overfilled. Option C. Continue using it until the lid will not close. Option D. Push the contents down to make space. The correct answer is option B. Replace or close it according to facility policy before it becomes overfilled. Sharps containers must not be overfilled because protruding sharps can cause injury. Biohazard bags do not provide puncture protection for needles. Waiting until the lid fails creates an avoidable exposure hazard. Pushing contents down places hands near contaminated sharps. Question 10. In a routine phlebotomy scenario, which item is an engineering control used to reduce blood-borne pathogen exposure in the pediatric clinic during a skills check? Option A. A handwritten exposure note. Option B. A longer tourniquet. Option C. A safety-engineered needle with a protective device. Option D. A reminder poster only. The correct answer is option C. A safety-engineered needle with a protective device. Engineering controls isolate or remove the hazard through device design, such as safety needles. A note documents information but does not prevent exposure. Tourniquet length does not protect against needle stick injuries. A poster may educate staff but does not physically control the sharp. Question 11. During a blood spill cleanup, which approach is most appropriate in the long-term care unit during a practice drill? Option A. Ask a patient to avoid the area and leave it. Option B. Use bare hands if the spill is small. Option C. Wipe the spill with dry paper towels only. Option D. Wear proper PPE and use an approved disinfectant according to policy. The correct answer is option D. Wear proper PPE and use an approved disinfectant according to policy. Blood spills require PPE and proper disinfection because blood may contain infectious material. Leaving the spill exposes others to contamination. Bare hands create direct exposure risk even with small spills. Dry towels alone do not disinfect contaminated surfaces. Question 12. During a scenario, which resource should be checked for safe handling information about a chemical disinfectant? Option A. The safety data sheet. Option B. The order of draw chart. Option C. The tube expiration label only. Option D. The patient's wristband. The correct answer is option A. The safety data sheet. A safety data sheet explains chemical hazards, PPE, storage, and spill response. An order of draw chart does not address disinfectant hazards. A tube label may show expiration but not chemical handling instructions. A wristband identifies the patient but gives no chemical safety guidance. Question 13. In the emergency department bay, which vein is usually preferred for routine venipuncture in an adult antecubital area? Option A. Femoral artery. Option B. Median cubital vein. Option C. Vein on the underside of the wrist. Option D. Basilic vein is the first choice. The correct answer is option B. Median cubital vein. The median cubital vein is commonly preferred because it is usually well anchored and less likely to roll. The femoral artery is not a routine venipuncture site for phlebotomists. The underside of the wrist has higher risk for nerve or tendon injury. The basilic vein is closer to nerves and arteries and is usually not the first choice. Question 14. How should the needle bevel generally be positioned when entering a vein in the physician office lab during a final review? Option A. Sideways with the tube already removed. Option B. Flat against the skin without entering. Option C. Bevel up at an appropriate shallow angle. Option D. Bevel down at a steep angle. The correct answer is option C. Bevel up at an appropriate shallow angle. A bevel-up approach helps the needle enter the vein smoothly and supports blood flow into the collection system. A sideways needle position is unstable and not standard technique. A needle flat against the skin will not properly access the vein. A bevel-down steep approach can increase discomfort and may pass through the vein. Question 15. At what angle is a routine venipuncture needle commonly inserted in the community health screening event during a study session? Option A. About 60 to 90 degrees. Option B. Parallel under the skin for several inches. Option C. About 5 degrees for every adult. Option D. About 15 to 30 degrees. The correct answer is option D. About 15 to 30 degrees. A 15 to 30 degree angle is commonly used to enter the vein without going too deep. A 60 to 90 degree angle is more likely to puncture through the vein. Advancing parallel for several inches increases tissue trauma and is not standard venipuncture. A very shallow angle may fail to enter the vein or may drag under the skin. Question 16. Before inserting the needle for a type and screen, why should the selected vein be anchored in the preoperative testing area during a structured exam prep drill? Option A. Anchoring stabilizes the vein and reduces rolling during entry. Option B. It replaces the need to cleanse the site. Option C. It allows the tourniquet to stay on longer. Option D. It sterilizes the skin. The correct answer is option A. Anchoring stabilizes the vein and reduces rolling during entry. Anchoring stretches the skin and helps keep the vein steady as the needle enters. Skin cleansing is still required before puncture. Anchoring does not justify prolonged tourniquet time. Anchoring does not sterilize skin or remove microorganisms. Question 17. After cleansing a venipuncture site with alcohol, when should the needle be inserted in the oncology infusion center during a clinical simulation? Option A. After blowing on the site. Option B. After the site air dries completely. Option C. After wiping the area with a used gauze pad. Option D. Immediately while the alcohol is wet. The correct answer is option B. After the site air dries completely. Allowing alcohol to air dry improves antisepsis and reduces stinging and hemolysis risk. Blowing on the site contaminates the cleaned area. Used gauze can reintroduce microorganisms to the puncture site. Puncturing through wet alcohol can sting and may affect specimen quality. Question 18. How long should a tourniquet generally remain in place before it risks hemoconcentration in the dialysis adjacent clinic during a review? Option A. Until all labels are printed. Option B. Only after the patient pumps the fist repeatedly. Option C. No longer than about 1 minute. Option D. At least 5 minutes for every draw. The correct answer is option C. No longer than about 1 minute. Tourniquet application beyond about 1 minute can concentrate blood components and alter some results. Administrative delays do not justify prolonged tourniquet use. Repeated fist pumping can also contribute to hemoconcentration. 5 minutes is excessive and can distort laboratory values. Question 19. When should the tourniquet be released during routine tube collection in the student skills lab during a mock exam? Option A. Before the needle ever enters the skin in every case. Option B. After 5 minutes to improve the specimen. Option C. Only after the patient leaves. Option D. As soon as blood flow is established and before removing the needle, following policy. The correct answer is option D. As soon as blood flow is established and before removing the needle, following policy. Releasing the tourniquet once blood flow is established helps reduce hemoconcentration and patient discomfort. Removing it before needle entry in every case may make vein access difficult. Prolonged application does not improve specimen quality. Leaving it on until the patient leaves is unsafe and unnecessary. Question 20. Why should patients avoid repeatedly pumping the fist during venipuncture in the occupational health clinic during a skills check? Option A. It may alter analytes such as potassium through hemoconcentration and muscle activity. Option B. It prevents all hematomas. Option C. It guarantees faster clotting in citrate tubes. Option D. It sterilizes the collection site. The correct answer is option A. It may alter analytes such as potassium through hemoconcentration and muscle activity. Repeated fist pumping can change blood composition and affect certain test results. Hematoma prevention depends on technique and post-draw pressure, not fist pumping. Citrate tubes are anticoagulated and do not rely on patient fist motion. Fist pumping has no antiseptic effect on the skin. Question 21. In the blood collection station, which needle gauge is commonly used for routine adult venipuncture with evacuated tubes? Option A 30 gauge needle for all adults. Option B 21 or 22 gauge needle. Option C. A lancet designed for heel stick only. Option D 12 gauge needle. The correct answer is option B. 21 or 22 gauge needle. A 21 or 22 gauge needle usually provides adequate flow while limiting trauma for routine adult veins. A 30 gauge needle is too small for standard evacuated tube collection and may slow flow. A heel stick lancet is not used for routine venipuncture. A 12 gauge needle is unnecessarily large and traumatic for routine phlebotomy. Question 22. For a patient with a small fragile hand vein, which device may improve control in the outpatient clinic during a scenario? Option A heel puncture lancet. Option B unprotected straight needle used without a holder. Option C winged infusion set with appropriate tube or syringe technique. Option D large bore blood donation needle. The correct answer is option C. Winged infusion set with appropriate tube or syringe technique. A winged infusion set offers better control for small or fragile veins when used according to policy. A heel puncture lancet is for dermal puncture, not accessing a hand vein. Using an unprotected straight needle without a holder is unsafe and not standard practice. A large bore donation needle is excessive and can injure a small vein. Question 23. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first in the hospital unit during morning rounds during a competency review? Option A. The discard tube removes EDTA carryover from the skin. Option B. The discard tube replaces patient identification. Option C. The discard tube warms the patient's arm. Option D. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. The correct answer is option D. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. EDTA carryover is managed by order of draw, not by removing it from the skin. No tube can replace proper patient identification. A discard tube is not used to warm the arm. Question 24. If no blood enters the tube after needle insertion, which action is safest first in the urgent care laboratory during a final review? Option A. Gently adjust needle position while staying within policy and patient comfort limits. Option B. Turn the needle in circles under the skin. Option C. Leave the needle in place while searching for another vein. Option D. Probe deeply until blood appears. The correct answer is option A. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. Rotating the needle under the skin is traumatic and not appropriate. A needle should not be left in one site while searching elsewhere. Deep probing increases pain, hematoma risk, and nerve injury risk. Question 25. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do in the pediatric clinic during a study session? Option A. Ask the patient to ignore it until the tube fills. Option B. Stop the draw, remove the needle safely, and follow facility procedure. Option C. Release pressure only after all tubes are collected. Option D. Advance deeper to pass the nerve. The correct answer is option B. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Ignoring the symptom places the patient at unnecessary risk. Continuing tube collection delays the response to a possible complication. Advancing deeper can worsen nerve injury. Question 26. During a difficult draw, why should excessive probing be avoided in the long-term care unit during a structured exam prep drill? Option A. It sterilizes the vein. Option B. It prevents the need for patient identification. Option C. It increases pain, hematoma risk, and possible nerve or tissue injury. Option D. It improves all specimen results. The correct answer is option C. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Needle movement has no sterilizing effect. Patient identification is always required regardless of draw difficulty. Probing does not improve laboratory accuracy. Question 27. If a vein collapses during evacuated tube collection, which change may help on a redraw in the mobile collection site during a clinical simulation? Option A. Keep the tourniquet on for several minutes. Option B. Tell the patient to pump the fist continuously. Option C. Use a stronger vacuum tube on the same fragile vein. Option D. Use a smaller tube, syringe, or winged set according to policy. The correct answer is option D. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. Prolonged tourniquet time can alter results and increase discomfort. Continuous fist pumping may affect analytes and does not solve vein collapse. A stronger vacuum can worsen collapse. Question 28. During a review, which site should generally be avoided unless specifically approved by policy or provider order? Option A. A foot or ankle vein. Option B. An acceptable dorsal hand vein. Option C. A suitable cephalic vein. Option D. A well-palpated median cubital vein. The correct answer is option A. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. A dorsal hand vein may be acceptable when antecubital veins are unavailable. The cephalic vein can be appropriate when assessed carefully. The median cubital vein is a common routine site when suitable. Question 29. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture in the physician office lab during a mock exam? Option A. All tubes drawn from that arm turn blue. Option B. The fistula must be protected from injury, infection, and altered blood flow. Option C. It eliminates the need for a tourniquet. Option D. The blood in that arm has no cells. The correct answer is option B. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Tube color is determined by the collection container, not the arm. Tourniquet decisions do not remove the risk to a fistula. Blood in the arm still contains cells. Question 30. Why is the site of a prior mastectomy often avoided for venipuncture in the community health screening event during a skills check? Option A. The skin cannot be cleaned. Option B. All specimens from that side clot immediately. Option C. Lymphatic changes can increase risk for swelling, infection, or complications. Option D. The veins always contain arterial blood. The correct answer is option C. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. The issue is not an inability to cleanse skin. Specimens do not automatically clot because of collection side. Venous blood does not become arterial because of mastectomy history. Question 31. When N4 is running in one arm, which collection choice is usually preferred in the preoperative testing area during a practice drill? Option A. Collect directly through the 4 tubing without authorization. Option B. Ignore the 4 because additives prevent contamination. Option C. Draw above the 4 site while fluid is running. Option D. Use the opposite arm when available and follow facility policy. The correct answer is option D. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from 4 fluids. Line draws require authorization and specific procedure. Tube additives do not correct 4 fluid contamination. Drawing above a running 4 can contaminate or dilute the specimen. Question 32. After reviewing the order, which finding makes a venipuncture site a poor choice in the oncology infusion center during a scenario? Option A. Edema, burns, scarring, or signs of infection at the site. Option B. Clean intact skin over an antecubital vein. Option C. A site that allows safe patient positioning. Option D. A vein that is palpable and resilient. The correct answer is option A. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. Clean intact skin supports safe site preparation. Safe positioning is desirable for venipuncture. A palpable resilient vein is generally a favorable finding. Question 33. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect in the dialysis adjacent clinic during a competency review? Option A. Successful fasting status. Option B. Hematoma formation. Option C. Normal clot retraction in the vein. Option D. Proper tube mixing. The correct answer is option B. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Fasting status cannot be determined by puncture site swelling. Clot retraction is a laboratory process, not a normal event around an active needle site. Tube mixing happens after collection and does not cause local swelling. Question 34. If a hematoma starts to develop during venipuncture, which action is appropriate in the student skills lab during a final review? Option A. Massage the swollen area vigorously. Option B. Ask the patient to bend the elbow tightly. Option C. Release the tourniquet, remove the needle, and apply pressure. Option D. Continue filling all ordered tubes. The correct answer is option C. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Vigorous massage can worsen bruising and tissue injury. Bending the elbow can increase bruising and does not provide focused pressure. Continuing the draw can enlarge the hematoma. Question 35. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the occupational health clinic during a study session? Option A. Leave the needle in while getting more tubes. Option B. Give the patient food before removing the needle. Option C. Ask the patient to stand up and walk it off. Option D. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. The correct answer is option D. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Standing can lead to a fall. Question 36. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the blood collection station during a structured exam prep drill? Option A. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option B. Ask the patient to bend the elbow sharply. Option C. Use the same bandage time for every patient without checking. Option D. Skip pressure to avoid bruising. The correct answer is option A. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Skipping pressure increases bleeding risk. Question 37. In the outpatient clinic, which action helps prevent a hematoma after removing the needle? Option A. Rub the puncture site to spread the blood. Option B. Apply clean gauze with firm pressure while the arm remains straight. Option C. Remove the needle before releasing the tourniquet every time. Option D. Have the patient bend the elbow tightly. The correct answer is option B. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Bending the elbow may increase leakage into tissue. Question 38. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the hospital unit during morning rounds during a review? Option A. Tube additive carryover. Option B. Normal capillary refill. Option C. Possible arterial puncture. Option D. Proper venous flow. The correct answer is option C. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Typical venous flow is darker and not pulsatile. Question 39. To protect patient safety, which tube is collected first when blood cultures are ordered with other venipuncture tubes in the urgent care laboratory during a mock exam? Option A. Gray fluoride tube. Option B serum separator tube. Option C lavender EDTA tube. Option D blood culture bottles or sterile culture tube. The correct answer is option D. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. EDTA tubes are collected later to prevent additive carryover. Question 40. In the standard venipuncture order of draw, which tube usually follows blood cultures in the pediatric clinic during a skills check? Option A light blue sodium citrate tube. Option B gray fluoride tube. Option C royal blue tube for every test. Option D lavender EDTA tube. The correct answer is option A. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. EDTA is collected later because it can interfere with coagulation and chemistry tests. Question 41. When preparing for collection, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes in the long-term care unit during a practice drill? Option A gray, lavender, green, serum, light blue, blood cultures. Option B blood cultures, light blue, serum, green, lavender, gray. Option C serum, lavender, blood cultures, gray, light blue, green. Option D lavender, gray, green, serum, light blue, blood cultures. The correct answer is option B. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Starting with lavender risks EDTA contamination of later tubes. Question 42. Why does order of draw matter during evacuated tube collection in the mobile collection site during a scenario? Option A. It eliminates the need to mix tubes. Option B. It determines the patient's fasting status. Option C. It helps prevent additive carryover from altering later specimens. Option D. It makes patient identification optional. The correct answer is option C. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Patient identification is required regardless of tube order. Question 43. During capillary puncture, which specimen type is generally collected first when ordered in the emergency department bay during a competency review? Option A gray top microtube. Option B non-additive tube after all others. Option C serum specimen. Option D blood gas specimen. The correct answer is option D. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Serum is not first when blood gases are ordered. Question 44. During a final review, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the physician office lab during a final review? Option A EDTA microtube before other additive and serum microtubes. Option B gray microtube first even when blood gases are needed. Option C. Any order because capillary tubes have no additives. Option D, serum microtube before EDTA for every draw. The correct answer is option A. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Blood gases are more time sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Serum first collection can allow clotting before the EDTA specimen is filled. Question 45. In the community health screening event, which tube is most appropriate for a routine CBC? Option A, gray sodium fluoride tube. Option B, lavender top tube containing EDTA. Option C, red no additive tube. Option D, light blue sodium citrate tube. The correct answer is option B. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Citrate is used mainly for coagulation testing. Question 46. For a type and screen collection, which additive is found in a light blue tube used for patient and APTT testing? Option A, sodium fluoride with potassium oxalate. Option B, lithium heparin. Option C, sodium citrate. Option D, EDTA. The correct answer is option C. Sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. EDTA is used mainly for hematology and can interfere with coagulation testing. Question 47. To protect patient safety, which tube is commonly selected for many serum chemistry tests when gel separation is desired in the Oncology Infusion Center during a clinical simulation? Option A, light blue citrate tube. Option B, gray fluoride tube only. Option C, lavender EDTA tube. Option D, serum separator tube with clot activator and gel. The correct answer is option D. Serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. EDTA plasma is not serum and can interfere with some chemistry tests. Question 48. After reviewing the order, which tube is commonly associated with heparinized plasma chemistry testing in the dialysis adjacent clinic during a review? Option A, green top tube. Option B, light blue top tube. Option C, pink top tube. Option D, lavender top tube. The correct answer is option A. Green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Lavender tubes contain EDTA for hematology. Question 49. When preparing for collection, which tube is most commonly used for glucose preservation when testing may be delayed in the student skills lab during a mock exam? Option A, light blue citrate tube. Option B, gray top tube with sodium fluoride and an anticoagulant. Option C, blood culture bottle. Option D, plain red tube only. The correct answer is option B. Gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. A plain red tube does not contain glycolysis inhibitor. Question 50. In a routine phlebotomy scenario, which tube is commonly used for blood bank testing such as type and screen in the occupational health clinic during a skills check? Option A, light blue citrate tube. Option B, green heparin tube for every blood bank test. Option C, pink top EDTA tube. Option D, gray top fluoride tube. The correct answer is option C, pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Gray tubes are associated with glucose or lactate preservation. Question 51. Before proceeding with the draw, which tube is generally collected for a blood culture specimen in the blood collection station during a practice drill? Option A, gray fluoride tube. Option B, SST after clotting. Option C, lavender EDTA tube only. Option D, sterile blood culture bottle or SBS containing culture tube according to policy. The correct answer is option D, sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. A lavender tube is not designed as the primary blood culture container. Question 52. Why must a light blue citrate tube be filled to the proper level in the outpatient clinic during a scenario? Option A. The blood to anticoagulant ratio must be correct for coagulation results. Option B, EDTA needs extra room to mix. Option C, serum cannot clot unless the tube is full. Option D. The tube color changes if underfilled. The correct answer is option A. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Tube color does not change to warn of underfilling. Question 53. After collecting an additive tube, how should it usually be mixed in the hospital unit during morning rounds during a competency review? Option A, leave it unmixed until centrifugation. Option B, gently invert the tube the recommended number of times. Option C, open the stopper and stir with a wooden applicator. Option D, shake it hard until bubbles appear. The correct answer is option B. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Vigorous shaking can cause hemolysis. Question 54. For a ammonia collection, which problem can occur if a lavender EDTA tube is not mixed soon after filling? Option A. The specimen turns into serum. Option B. The sodium citrate ratio improves. Option C, microclots may form and make hematology results unreliable. Option D. The tube becomes sterile for culture. The correct answer is option C. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Mixing does not create sterility for culture testing. Question 55. To protect patient safety, which practice helps reduce hemolysis during a routine lactate collection? Option A, shake additive tubes vigorously. Option B, pull back a syringe plunger as hard as possible. Option C, force blood rapidly through a small needle. Option D, use appropriate needle size and gently invert tubes instead of shaking them. The correct answer is option D. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Forcing blood through a small needle can damage cells. Question 56. After reviewing the order, which laboratory result is especially affected by hemolysis because red cells release intracellular contents in the long-term care unit during a structured exam prep drill? Option A. Potassium may be falsely increased. Option B. Tube expiration date is extended. Option C. Tourniquet pressure becomes lower. Option D. Patient date of birth becomes invalid. The correct answer is option A. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Patient demographics are not changed by cell rupture. Question 57. When using a syringe for blood transfer, which method best protects specimen quality in the mobile collection site during a clinical simulation? Option A. Squirt blood through the needle into each tube. Option B. Use a safety transfer device and allow blood to flow gently into tubes. Option C. Shake each tube hard to remove clots. Option D. Remove the tube stopper and push blood in forcefully. The correct answer is option B. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Removing stoppers increases exposure and contamination risk. Question 58. Why should alcohol be allowed to dry before puncture in the emergency department bay during a review? Option A. Wet alcohol improves vein anchoring. Option B. Alcohol drying replaces tourniquet use. Option C. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option D. Dry alcohol makes the tube additive stronger. The correct answer is option C. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Drying does not change the chemical strength of tube additives. Question 59. Before proceeding with the draw, which specimen often requires protection from light after collection in the physician office lab during a mock exam? Option A. Routine sodium citrate coagulation tube. Option B. Blood culture bottle during incubation. Option C. CBC specimen for platelet count. Option D. bilirubin specimen. The correct answer is option D. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Question 60. During a skills check, which specimen commonly requires rapid transport on ice or chilled handling according to policy in the community health screening event during a skills check? Option A. Ammonia specimen. Option B. Serum separator tube for a lipid panel after clotting only. Option C. Blood culture bottle placed in the freezer. Option D. Routine CBC kept for the next day. The correct answer is option A. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. A routine CBC should not simply be held for the next day without stability guidance. Question 61. In the preoperative testing area, which action best maintains specimen integrity during transport to the laboratory? Option A. Centrifuge every tube immediately regardless of type. Option B. Follow required time, temperature, light, and handling instructions for the ordered test. Option C. Place all blood specimens in direct sunlight. Option D. Store every specimen at room temperature overnight. The correct answer is option B. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Overnight room temperature storage can make many specimens unacceptable. Question 62. If a specimen must be transported cold, which approach is appropriate in the Oncology Infusion Center during a scenario? Option A. Hold it in a bare hand to keep it visible. Option B. Place it near a heater until pickup. Option C. Place the specimen in the approved cooling method without direct water contamination. Option D. Submerge the tube in loose ice water. The correct answer is option C. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Loose ice water can damage labels and create contamination issues. Question 63. To protect patient safety, which situation is a common reason for specimen rejection in the dialysis-adjacent clinic during a competency review? Option A. Patient stated date of birth. Option B. Tube was labeled at the bedside. Option C. Collector wore gloves. Option D. Wrong tube type or insufficient specimen volume. The correct answer is option D. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Wearing gloves is expected when blood exposure is possible. Question 64. Why should tube expiration dates be checked before collection in the student skills lab during a final review? Option A. Expired tubes may have inadequate vacuum or unreliable additive performance. Option B. Expired tubes prevent hemolysis in every case. Option C. Expired tubes are required for coagulation testing. Option D. Expired tubes identify patients faster. The correct answer is option A. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Expiration dates do not help verify identity. Question 65. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the occupational health clinic during a study session? Option A. Tell the patient not to mention the meal. Option B. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Option C. Cancel every test without notifying anyone. Option D. Draw the specimen and write fasting on the label. The correct answer is option B. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Marking the specimen as fasting would be inaccurate documentation. Question 66. Why is fasting status important before some chemistry tests in the blood collection station during a structured exam prep drill? Option A. Fasting makes needles sterile. Option B. Fasting eliminates the need for tube mixing. Option C. Food intake can alter analytes such as glucose or lipids. Option D. Food changes the patient's legal name. The correct answer is option C. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Food intake does not affect patient identity. Question 67. For a medication trough level, when is the specimen usually collected in the outpatient clinic during a clinical simulation? Option A. At any random time during the day. Option B. Only after the medication is discontinued for a week. Option C. Immediately after the medication is swallowed. Option D. Immediately before the next scheduled dose. The correct answer is option D. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Immediately after dosing reflects absorption or peak timing, not trough. Question 68. During a glucose tolerance test, why must collection times be followed carefully in the hospital unit during morning rounds during a review? Option A. Timed results show how the body responds to a measured glucose dose. Option B. Timing only matters after the last tube. Option C. The patient should eat between timed draws to stay comfortable. Option D. Any time is acceptable if the tubes are gray. The correct answer is option A. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Tube type does not remove the need for precise timing. Question 69. In the urgent care laboratory, which documentation is especially important for a timed specimen? Option A. Only the patient's room number. Option B. Exact collection time recorded on the label or requisition according to policy. Option C. A note saying collected sometime today. Option D. The phlebotomist's favorite tube brand. The correct answer is option B. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Tube brand does not communicate timing. Question 70. Before collecting blood cultures, why is careful skin antisepsis critical in the pediatric clinic during a skills check? Option A. It eliminates the need for sterile bottles. Option B. It changes venous blood into arterial blood. Option C. It reduces contamination that could cause a false positive culture. Option D. It makes EDTA tubes clot faster. The correct answer is option C. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. EDTA clotting is unrelated to culture site preparation. Question 71. When collecting blood cultures with other tubes, which priority is most important in the long-term care unit during a practice drill? Option A. Touch the bottle tops after cleaning to confirm dryness. Option B. Use a non-sterile transfer cup. Option C. Collect cultures after gray tubes. Option D. Maintain sterility and collect cultures before non-sterile tubes. The correct answer is option D. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Collecting cultures after other tubes increases contamination risk. Question 72. If using a winged set for blood cultures, why is bottle order guided by facility policy in the mobile collection site during a scenario? Option A. Air in the tubing can affect which bottle should be filled first. Option B. The order prevents the need to clean the site. Option C. The order makes the needle reusable. Option D. The order determines the patient's identity. The correct answer is option A. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Bottle order does not verify patient identity. Question 73. For a legal blood alcohol collection, which requirement is especially important in the emergency department bay during a competency review? Option A. Leave the specimen unlabeled until court. Option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Option C. Let the patient carry the open tube to the lab. Option D. Use alcohol swabs for every blood alcohol specimen. The correct answer is option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Question 74. In a routine phlebotomy scenario, which action best supports chain of custody for a drug screen specimen in the physician office lab during a final review? Option A. Store the specimen in an unlocked public area. Option B. Discard the seal after collection. Option C. Document each person who handles the specimen from collection to transfer. Option D. Use only verbal handoff with no signatures. The correct answer is option C. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Verbal handoff alone does not create a traceable legal record. Question 75. Why are tamper-evident seals used on forensic or workplace testing specimens in the community health screening event during a study session? Option A. They make refrigeration unnecessary for all tests. Option B. They prevent the need for a requisition. Option C. They replace patient consent. Option D. They help show whether the specimen was opened or altered after collection. The correct answer is option D. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. A seal does not replace required consent or authorization. Question 76. For an infant heel stick, which area is safest for puncture in the preoperative testing area during a structured exam prep drill? Option A. Medial or lateral plantar surface of the heel. Option B. Center of the arch. Option C. Tip of the great toe. Option D. Posterior curvature of the heel. The correct answer is option A. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. The posterior curvature increases risk of bone injury. Question 77. Why should an infant heel puncture not be too deep in the oncology infusion center during a clinical simulation? Option A. Depth determines the tube color. Option B. Excessive depth can injure bone or deeper tissue. Option C. A deep puncture replaces the need for warming. Option D. A deeper puncture always prevents hemolysis. The correct answer is option B. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Deeper puncture can increase injury and does not guarantee specimen quality. Question 78. For a troponin collection, which finger is generally preferred for adult capillary puncture? Option A. Index fingertip in all adults. Option B. Little finger near the bone. Option C. Middle or ring finger on the palmar surface near the side of the fingertip. Option D. Thumb pad for every test. The correct answer is option C. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. The thumb may be more calloused and is not the routine first choice. Question 79. After a finger puncture, why is the first drop of blood commonly wiped away in the student skills lab during a mock exam? Option A. It proves the patient is fasting. Option B. It activates the tube vacuum. Option C. It contains only white blood cells. Option D. It may contain tissue fluid or contaminants that can affect the specimen. The correct answer is option D. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. The first drop is not composed only of white blood cells. Question 80. How can warming a capillary puncture site help collection in the occupational health clinic during a skills check? Option A. It increases local blood flow when used safely. Option B. It removes the need to identify the patient. Option C. It makes every specimen suitable for culture. Option D. It sterilizes the skin completely. The correct answer is option A. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Warming does not sterilize skin. Question 81. Why should excessive squeezing or milking be avoided during capillary collection in the blood collection station during a practice drill? Option A. It makes EDTA unnecessary. Option B. It can dilute the specimen with tissue fluid and cause hemolysis. Option C. It prevents clotting in serum tubes. Option D. It improves all glucose results. The correct answer is option B. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Glucose results can be affected by poor specimen quality rather than improved. Question 82. When is dermal puncture commonly preferred over venipuncture in the outpatient clinic during a scenario? Option A. For all coagulation studies regardless of policy. Option B. Whenever patient identification is incomplete. Option C. For some infants, small volume tests, or patients with difficult veins when appropriate. Option D. For every blood culture set. The correct answer is option C. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Blood cultures usually require sterile venipuncture collection and adequate volume. Question 83. A child begins to pull away during a draw. Which action supports safety in the hospital unit during morning rounds during a competency review? Option A. Scold the child until they stop. Option B. Ask another child to hold the arm. Option C. Continue while the arm is moving. Option D. Pause if needed and obtain appropriate assistance for safe positioning according to policy. The correct answer is option D. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Continuing while the arm moves increases injury risk. Question 84. During a final review, which explanation is best for a young child before a finger stick in the urgent care laboratory during a final review? Option A. Use simple honest words such as a quick pinch and explain what they can do to help. Option B. Use detailed adult medical terminology. Option C. Promise a toy only if they do not cry. Option D. Tell the child nothing will happen. The correct answer is option A. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Saying nothing will happen is misleading. Question 85. For an older adult with fragile veins, which technique is most appropriate in the pediatric clinic during a study session? Option A. Use the largest needle available. Option B. Use gentle anchoring and consider a smaller needle or controlled collection device. Option C. Leave the tourniquet on for several minutes. Option D. Slap the site hard to make veins appear. The correct answer is option B. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Slapping can injure delicate skin and is unprofessional. Question 86. Why should adhesive bandages be used carefully on some older adults in the long-term care unit during a structured exam prep drill? Option A. Older adults never need pressure after draws. Option B. Bandages prevent all anticoagulant bleeding. Option C. Fragile skin can tear when adhesive is removed. Option D. Adhesive changes the blood type. The correct answer is option C. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Adhesive has no effect on blood type. Question 87. Before assembling equipment for a patient/INR draw, which item should be checked in the mobile collection site during a clinical simulation? Option A. The patient's favorite beverage. Option B. The brand of wall clock in the room. Option C. Only the color of the chair. Option D. Tube type, expiration date, needle safety device, and requisition requirements. The correct answer is option D. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Chair color has no role in specimen acceptability. Question 88. After reviewing the order, which sequence is safest after blood has entered the final tube in the emergency department bay during a review? Option A: release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option B: activate safety device before removing the needle from the arm. Option C: remove the needle and recap it before pressure. Option D: withdraw needle with tourniquet tight and no gauze ready. The correct answer is option A. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Withdrawing with the tourniquet tight can increase bleeding and bruising. Question 89. When preparing for collection, which action should occur before leaving the patient after venipuncture in the physician office lab during a mock exam? Option A: tell the patient to remove the bandage immediately. Option B: confirm bleeding has stopped and provide appropriate post-draw instructions. Option C: dispose of sharps after walking to another room. Option D: leave while blood is still oozing. The correct answer is option B. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Leaving active bleeding unattended is unsafe. Question 90. Why is patient positioning important before venipuncture in the community health screening event during a skills check? Option A. It changes EDTA into citrate. Option B. It allows the needle to be reused safely. Option C. It reduces the risk of falls or injury if the patient becomes dizzy. Option D. It makes labeling unnecessary. The correct answer is option C. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Body position does not change tube additives. Needles are single-use and cannot be reused. Proper positioning does not replace specimen labeling. Question 91. Before proceeding with the draw, which patient instruction is appropriate after a routine venipuncture in the preoperative testing area during a practice drill? Option A: remove the bandage while still bleeding. Option B: bend the elbow tightly for 10 minutes. Option C: scratch the site if it feels itchy. Option D: keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. The correct answer is option D. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Scratching can disrupt the site and introduce contamination. Question 92. During a scenario, which laboratory department commonly performs CBC testing in the Oncology Infusion Center during a scenario? Option A: hematology. Option B: blood bank only. Option C: histology only. Option D: microbiology only. The correct answer is option A. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Microbiology focuses on organisms and cultures. Question 93. In the dialysis-adjacent clinic, which department usually performs patient and APTT coagulation testing? Option A: microbiology culture bench only. Option B, coagulation or hematology coagulation section. Option C, cytology screening only. Option D, urinalysis only. The correct answer is option B, coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Urinalysis focuses on urine specimens. Question 94. For a thyroid panel collection, which department is most associated with blood cultures? Option A, histology tissue processing. Option B, chemistry electrolyte analysis only. Option C, microbiology. Option D, blood bank compatibility only. The correct answer is option C, microbiology. Microbiology processes cultures to detect and identify microorganisms. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Blood bank testing focuses on transfusion compatibility. Question 95. To protect patient safety, which department commonly performs type and screen testing in the occupational health clinic during a study session? Option A, chemistry only. Option B, parasitology stool testing only. Option C, microbiology only. Option D, blood bank or transfusion services. The correct answer is option D, blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Microbiology focuses on infectious organisms. Question 96. After reviewing the order, which department commonly analyzes electrolytes such as sodium and potassium in the blood collection station during a structured exam prep drill? Option A, chemistry. Option B, blood bank compatibility bench. Option C, cytogenetics only. Option D, histology. The correct answer is option A, chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Histology focuses on tissues. Question 97. When preparing for collection, which practice is part of phlebotomy quality assurance in the outpatient clinic during a clinical simulation? Option A, changing tube labels after results are reported. Option B, tracking specimen errors and using corrective action to prevent recurrence. Option C, skipping competency checks for experienced staff. Option D, ignoring mislabeled specimens if the patient is well known. The correct answer is option B, tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Familiarity with a patient does not make a mislabeled specimen acceptable. Question 98. Why are competency assessments important for phlebotomists in the hospital unit during morning rounds during a review? Option A. They allow staff to ignore order of draw. Option B. They are only for patients who complain. Option C. They verify that staff can perform required skills safely and consistently. Option D. They replace all written procedures. The correct answer is option C. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Written procedures are still needed as standards for practice. Question 99. Before proceeding with the draw, which error should be reported through the facility's quality process in the urgent care laboratory during a mock exam? Option A. A tube is mixed according to instructions. Option B. A needle safety device is activated after use. Option C. A patient correctly states their date of birth. Option D. A specimen collected in the wrong tube type. The correct answer is option D. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Correct identity confirmation is expected practice, not an error. Question 100. During a skills check, which activity is commonly associated with CLIA waived point of care testing? Option A. Following manufacturer instructions and documenting quality control for a simple approved test. Option B. Reporting results without controls when controls are required. Option C. Using expired test strips because they look normal. Option D. Changing the test procedure to save time. The correct answer is option A. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Modifying the procedure can invalidate the test category and results.